Hi, everyone, and welcome to On the Horizon in Healthcare. My name is Dr. Beth Brooks, and I'm the clinical advisor here at Vivian Health. And today I want to share with you some findings from our recent workforce survey. Every year, Vivian Health conducts a survey to ask our different nursing staff and other clinicians what's going on in their work life. And so today I'd like to share some of those findings with you. So we have our findings from our 2023 report. And I'm going to also share some of the findings from last year as compared to what we learned in the prior year. I'm going to talk a little bit about some of the surprising, I think, findings about renewed emphasis around work-life balance. And then finally want to end with some recommendations that you might consider implementing in your organization. So let's start a little bit with a background on the workforce, just to refresh everyone's memory. As you all are well aware, we are once again in a nursing shortage. We have these cyclical shortages that have gone on for many years. So we are having a shortage of registered nurses. We lost a number of registered nurses that came out of the workforce during COVID. Not the typical retirement age nurses that most folks thought were leaving. It tended to be the younger nurses who had children at school age at home or needed daycare. And so there was 100,000 nurses that left that workforce during COVID. We do know that there's 600,000 baby boom nurses expected to retire in the next few years. And there's been a lot of controversy around who's leaving the profession, who's leaving their position. And for most of the data I've seen, and I'll talk a little bit more about this, nurses are talking about leaving their current position. There has not been any compelling recent research with a large sample size that indicates that nurses are leaving the profession. Although I will say our nursing workforce is aging, and that has continued over the last 3 or 4 or 5 years. And now we have over 1 million of our 4.4 nurses in this country who are over 50 years of age. And unfortunately, turnover continues to be a problem. And turnover can be from anywhere between 9 and 30%, 37%, depending on which studies you look at. And I've been looking at studies from the American Association of Critical Care Nurses, the American Nurses Association. Have been studying and reading a lot of Peter Burhouse's work, which many of you are familiar with in the nursing workforce. And so we know that nurses are leaving the workforce, and this has been a very atypical change that we've gone through as a result of COVID. It's really quite changed the nature of our workforce. So here's some interesting results from the most recent National Student Nurses Association survey. And I think for myself, the thing that I found the most surprising, granted, there was a lot of very interesting information in this study, but the one thing that I thought was really interesting is that this young group of new graduate nurses, so the nurses that graduated in 2021, May, and then into December of 21. That survey was taken at the early part of the year, and those results are now out. So the study is reporting 21 data, and it was published in 22, just to be clear on timing there. But the number one choice of the new graduate nurses that they were most interested in working was in travel nursing. And I think that's probably the first time we've seen that kind of change in the career specialty desires of our new graduates. Number 2 was ICU nursing, which is probably all not very surprising. And then number 3 was emergency department and OB. So again, those top 3 usually were ICU, OB, and emergency department. And this year, travel nursing came in as the number 1 choice. The other thing I learned from reading the report from the NSNA, 93% of those new graduates were hired within 3 months. So that tells me that organizations need to really be having a smooth running and smooth flow in how they're interviewing applicants. And one of the things we learned in our data from the Vivian survey was that 36% of the travel nurses want to return to permanent positions, and that 86% of the whole group of subjects in that study are willing to return to permanent positions. So it's definitely the changes that have happened in the travel workforce. There's been significant changes in the salary, and travel nursing is not meant for everyone. It's a career choice that's very different and may not work for everyone's lifestyle. So there are a number of people willing and ready and able to come back into permanent employment. One of the things I think that, again, retention and turnover are always important to us. But 44% of the staff in our study were permanent staff. So we had a large group of permanent staff who were giving us the same kind of feedback as the nurses who are travel nurses. So when we do our study, we have a little bit of both kinds of nurses working in our database. Also, you need to know that 7% of the nurses in our study are over 45 years of age. So again, it's skewing a little bit older. And we do have, again, continuing very high levels of stress in this nursing workforce. And you can see here where 67% of the nurses in our study reported having high stress, and they ranged from nurses with 3 years of experience all the way through 24 years of experience. So certainly the stress has not changed terribly much in this last year. So going back to what I mentioned earlier about who's leaving the profession, it turns out not as many as we thought. And again, this goes back to some, if you will, sensationalized reports in the media about nurses leaving in droves. And some of the studies that were cited were, 200 nurses. And so it's pretty difficult to generalize the finding from a study of 200 nurses to the 4 million nurses that work in our country. So from the data that I've seen from much larger samples, like the American Nurses Association, which surveyed 11,000 nurses, the intent to leave the profession seems to run about 8 to 10%. And so that's not as dire as what we're hearing in the media. So leaving the profession is also a little bit of, you have to very carefully think about what that means, because for some people, if I leave bedside nursing, I've left the profession. But if I leave bedside nursing to work in a clinic, some people might think that that's leaving the profession, because so many people assume, and granted, working in a hospital is the largest percentage of where nurses work, but nurses can be found in many other kinds of settings. So we do know that really only 8 to 10% of nurses are contemplating leaving the profession. And the 8% comes from a study of the critical care nurses. 10% is more all types of nurses from the American Nurses Association study. So when are these nurses going to leave? Well, it's a little bit inconclusive. Some nurses intend to leave very quickly. Some are going to wait a bit of time to see how things change in their organizations. So there's no magic number here or magic time, but I think the most vulnerable time is this next year. So things that you can do to recommunicate with your staff and re-talk to your staff about the benefits of your environment and why you'd like to retain that talent. This is probably the time to be having those conversations. So some of the things mitigate any turnover are some of the things in the work environment that you can, and in fact can control, or some things that you can begin to work on. So again, in our 2023 Future of Health report, we found a top 5, you'll see on the side, the top 5 reasons. Workload is absolutely the number one concern of nurses, and that is directly related to staffing, both nurse staffing as well as staffing of our ancillary and support team members. Well-being came across very loud and even almost more pronounced than it was during the pandemic. And certainly we've had many reports in the news about patients and families perpetrating violence against nurses, and many hospitals and some of my colleagues I've talked to are really focusing some of their efforts around creating a safe work environment, teaching everyone de-escalation techniques, and really keeping an eye on keeping our staff safe. It's very difficult to do your job as a nurse if you don't feel safe. And then we have the issue of bullying and incivility and sort of what we call sometimes lateral violence. So what are we doing to mitigate any bullying in the organization, any incivility? Again, in the American Nurses Association study, there was quite an uptick in bullying and incivility by physicians towards nurses, and in addition to the bullying and incivility from patients and families. So some work absolutely to be done there. Mental health continues to be a concern, and I just did a recent podcast and webinar about relooking at your employee assistance program. The other thing I found really interesting in our results this year was the commute time, something that hadn't seen in the past in our data, but that time spent in the car can be a real drain and real fatiguing. And so looking at opportunities perhaps for ride sharing or childcare, some of the comments about the time to go to childcare back and forth and then commute to work. All of those things are areas that nurses are re-examining in terms of their work-life balance. And as you can see here, just from some of the other data, I think the other concerning thing was the inability to take paid time off. There were moratoriums on PTO and vacations during COVID. This is the time absolutely to make sure your staff are taking the PTO time. Probably not the best time to be doing extra hours if you can at all help it, and giving your staff some time off that they can recuperate between different shifts. And I want to talk about that a little bit later. So here's the overtime frequency. And again, this is relative to, fatigue. We have used quite a bit of overtime, whether it was mandatory or voluntary. We've asked our staff not to take PTO, not to take vacation, and it's really accumulating. And that fatigue is accumulating. So you can see every week from our data, staff are being asked to work additional shifts. And that's not to say that you can't do that, but it begs the question if that should be your first approach or the first strategy to trying to staff the unit, because you do need to be mindful of that cumulative effect of fatigue. And so over 59% of nurses in the American Nurses Association study said that they were asked to work an extra shift every week. And we found that same kind of data. So it's time now, I think, to go back and relook at frequency of overtime, consecutive shifts, and give our staff time to recuperate. And here's just a little more data teased out between the staff in our database, that is all staff, some who are working permanent positions and some who are traveling. And you can see that we have work to do around being mindful of who's taking time off when, and what kinds of activities are we doing to support mental health. And I will say, and I'll come back to this at the end, continuing to make sure that you have some method, and there's many methods available, to ask for input from your staff, whether that's a formal shared governance type of program, or whether that's town hall meetings or a suggestion box or whatever that might be. That need to be heard and that need to have some input is still very important to staff. And it's something that you certainly want to continue doing to help keep retention very high and mitigate anything you can to eliminate or reduce turnover. So wages, that's always a very hot topic, if you will. And what we learned, interesting, and when we did our study here at Vivian, back in 2021, sort of at the height of the pandemic, nurses were looking for $64 to $65 an hour to come back into a permanent position. And that has made many a CFO and CNO lose sleep over the last year. Interestingly enough, that has come down a little bit. So nurses are saying, $61 an hour is what I would consider to come back to permanent employment. And I think one of the things you have to be mindful of is when nurses are quoting $61 an hour, that's because that's what they hear the travel nurses are making. It's not a bad idea to go back and remind your own staff that their hourly wage is not their total compensation. And so making sure that a travel nurse and your own staff are comparing apples to apples and making sure that they're not hearing a very high hourly rate when that hourly rate may not be that far off from what the hourly rate is in your organization when you add statutory benefits. So just sort of keep that in mind, how you might want to have that conversation with your teams. And then also in our database are a number of allied health professionals. And so I've given you some other pieces of data here about what kinds of salary expectations those professionals are having to come back into the workforce. The other thing that I thought was really interesting in our data was some of the data around, I'm just reading my notes, which of the following benefits are the most important to you? Number one, healthcare, right? Medical and dental. Number two, retirement, pension or benefit plan. And then number three was vesting time into the 401k. So that might be something worth looking at your organization to see how quickly new employees are vested into your 401k. And then also the last two items of the important benefits was short-term and long-term disability. And then of course, tuition reimbursement. So from all this data, we have a sense of we've got some work to do, right? We've got some salary concerns, some opportunities to talk about total compensation, certainly some workforce staffing issues, creating a healthy work environment. So I want to share some specific recommendations that came from our survey. And I've prioritized them based on what our respondents said. But then I'm also going to provide you with some recommendations and some suggestions. So here again, hourly wage, keeping in mind your wages compare with the travel nurse wages and maybe having that conversation. Taking a look at the benefits. Are there opportunities to maybe change some of those benefits? One of the things I've talked about recently in one of my videos is about the employee assistance program and what are some of the changes or enhancements that you might make to your employee assistance program to help staff through this time. Also, just reminding the staff that you have an employee assistance program. It can be easy to forget that option or that employee benefit is available. So there's another strategy to be thinking about. Workload, lots of organizations are looking at new care delivery models, looking at top of scope, top of practice. Are our nurses practicing at the top of their license? Do we have the right mix of support team members to help the nurses do the role or the work that only requires their expertise? Commute time, I thought, was a really interesting result this time in this survey. And I think that goes back to that work-life balance, which feeds right into flexible schedules. So the extent that your organization can have some opportunity to use different staffing methodologies, potentially using 4-hour, 6-hour, 8-hour, 10-hour shifts, coming up with some different options that will help your staff both balance their work life, let them recover from fatigue, and just provide that flexibility that they're looking for now, which is a little bit different than what we've seen in the past. Some other just kind of interesting facts here and there that came out of our survey data. And really, I don't know that any of these are brand new findings, if you will, but what I do think is interesting is this beating of the drum, right? We're continuing to see the same concerns rising from the nursing workforce and others on the healthcare team. And so this is the time to really think about what are those opportunities for change in your organization. So certainly nurses are, one of the things that the travel nurses do say that they miss is that opportunity for career development and the feeling of being in a community and being a respected member of the team. So anytime you can promote those kinds of cultural aspects to a travel nurse, that is going to entice them back into a permanent position. Most important things to be thinking about is leadership. And again, it goes to that idea of participative leadership or shared decision-making or seeking nursing or other staff's input into decision-making. All of those things are really important because staff are wanting to be heard and have not necessarily felt heard during the last few years of this pandemic. And then, of course, staffing and workload and support staff all sort of bundled together and are all related. I think the one thing to keep in mind, that's what's coming, right? And what's coming is, I think this gig economy is staying. I think nurses are going to continue to enjoy the flexibility. They can continue to travel if they'd like, if their spouse can work from home. These sort of finite tours of duty, starting to see more of that written about in the literature. And nurses are being much more self-directed about what they want in their career and where they feel they can achieve those career goals they have. So to be thinking about adapting your environment to the career demands, if you will, of a new generation of nurses. This is a new generation of nurses, and we all know that. But what does that really mean from a day-to-day scheduling and staffing and work environments? And I actually read an article a couple of weeks ago about staff churn may be the new normal, and there may always be this kind of churn on your unit of staff. And so how do we rethink about orientation, onboarding, and leading on a unit when there may always be a cadre of core staff, but then a cadre of staff that are either float or flex or travel? And how do we adapt our organizations in that way? Most of again, I think I've talked about this a little bit. If there's any kind of negative input or negative feeling about a current employer, it tends to be around this area of my inputs and having a voice and wanting to be heard. So making sure that those opportunities are available. And probably, certainly town halls are great, but folks can be reluctant to speak up in that setting. So perhaps more small, intimate settings. I have a number of colleagues who have lunches or breakfasts with their nursing team staff, just to sort of get a flavor of a pulse on what's happening at the bedside. So some of those more intimate strategies or intimate approaches to group meetings may help you hear some information that you might not hear in a larger group setting. So here are the 5 recommendations. Again, thinking about salary. I keep beating this drum, and I maintain that it's got a lot to do with the fact that nursing is on the wrong side of the ledger. We continue to be a cost center, even though we're generating revenue. And so I think rethinking how we're compensating nursing is probably not a bad thing at this time. Work-life balance has become increasingly more important to nurses. Maybe looking at different scheduling, workforce optimization modeling. I've done a video on that to try to understand more precision around staffing and using big data, which then allows you to have more flexible scheduling options, allows you to monitor consecutive shifts, allows you to monitor more readily who's taking PTO, are folks getting enough rest between shifts. Might want to think about having daycare on your campus. That has come up in a couple of other surveys that I've seen and some other editorials. Once again, workload, there's not much more to say there. This is the opportunity to be thinking about different skill mixes, care delivery models, continue to use shared leadership or shared decision-making or a shared governance model. Any type of participatory leadership style is really what's called for at this time. And then focusing on health and well-being. Again, relooking at your employee assistance program, talking to your employee assistance program provider. Perhaps there's opportunities for them to modify their programs, do more programs on site if there's a need for support groups, making sure that your employees know that the EAP is available to them. And again, really monitoring, are your staff taking PTO? It can be really easy to lose track of that, and making sure that there's enough time between shifts for mental health and recovery. What are the texting or the paging habits and patterns on your unit with your team? All of those distractions when you're supposed to be off the grid don't let your staff recuperate fully. And so rethinking some of those, which can be cultural issues about how much you contact staff when they're on their time off, all sort of contributes to that feeling that, that the staff and their contribution to your organization is important, but so is their health and mental well-being, because it's you can't do your job if you start to become stressed and then fatigued, which leads to burnout, which leads to that cynicism. And that's just typically will result in turnover. And that's the last thing we need at this point. So I wanted to thank you for joining me today. I know it was a little bit longer than I typically talk for one of my videos, but I felt it was really important to share with you all the findings from our survey, a little larger sample size, perhaps a little more generalizable. If you have questions, would like to receive a copy of our report, please let us know, and you can reach us at hire.vivian.com. And thank you.